Hello, I am Dr. Girish Rao. How is the surgery done? Most of the times these surgeries are quite extensive surgeries and it will require a general anesthesia. That means that you will have to be admitted in the hospital and we do a quick procedure in the hospital under anesthesia. By and large, it will take anywhere between 2 hours to about 5 to 6 hours of surgery. And the hospitalization is usually 2 to 3 days maximum. Many times if it is a single jaw, we can do what is called as a decade surgery. You come in the morning, undergo the surgery, and you go back either the evening of surgery or the next day of surgery. Generally, these surgeries are all done from inside the mouth. So we do not cause any marks on the face. Inside the mouth, the scars are all hidden and the mucosa heals very, very well. So it's absolutely no marks on the face at all. Now, the way in which we do these surgeries, we do a calculated cut in the bone so we can reposition the jaws. If the jaw is protruded, we make some cuts at the back near the wisdom tooth or behind the wisdom tooth and push the entire jaw back and fix it in the new position using tiny plates and screws. When we are doing it in the upper jaw also, we make cuts beyond the teeth in the where the reflection of the cheek is into the jaw. So we do the cuts there, fine cuts there. We make cuts in the bone, reposition the jaw, and generally hold it in the new position using tiny plates and screws. So generally these things do not cause any issues. You might have a bit of swelling maybe for a day or two. And by the time you become normal, it is generally about a week's time. So it is pretty good in terms of healing. And once the swelling comes down, you can get back to your normal lifestyle. You can eat normally, you can chew normally, and you can speak normally. So orthognathic surgery or facial improvement surgeries is very predictable. We calculate a lot of mathematics is there. And today with virtual surgical planning using computers, we can predict and determine exactly using precision how much of tooth movement can happen, how much of jaw movement can happen, and this could be very, very precise. A lot of people ask, are these surgeries very expensive? Can we afford it? Yes, today most of these surgeries would cost anywhere between 2 to 4 lakhs, and it is very, very affordable, I would say. That's because you require hospitalization, you require post-operative care in the post-op ward, the medicines which are involved in it, and the tiny plates and screws which we use. So overall, it is not very, very expensive compared to a lot of other places in the world. India is very affordable, so we do get a lot of patients coming from across the globe because healthcare is very much affordable over there. And the technology has grown by leaps and bounds. We use a lot of planning software. We do what's called as virtual surgical planning. And with this, we can bring in precision. So thereby, the healing is very, very quick. The surgical procedure itself can be minimized and the hospital stay can also be minimized with using technology. So thereby, I think it is very much affordable today in Bangalore, in India. What is the follow-up and aftercare? Generally, the hospitalization, as I said earlier, is probably for about 2 to 3 days maximum. And then we generally see the patients a week later. We may have to follow up with the patients for at least about 2 to 3 weeks till the jaw position settles down. And if we have done orthodontics beforehand, we need to complete what is called as the post-surgical orthodontics to correct the bite. That might take about 6 months. So generally within about 2 to 3 weeks, you can get back to your college or to your work, and you can get back to your normal life within about 2 to 3 weeks, I would say. How does it affect the psyche of an individual? A lot of people whom I see, because unfortunately they have a bit of deformity in the face, they're beautiful people, but because of the asymmetry of the face, or when they smile, they're not able to show teeth, or they show too much of teeth. Because of these kind of underlying problem, they generally become very, very introvert, I would say. They do not socialize many a times, and they're never confident. What we have seen is, following our orthognathic surgery or jaw improvement surgeries, there is a complete transformation, a life-changing experience, I would say, following this surgery. They totally become opposite to what they were. They become super optimistic. They really want to showcase to the world that they are looking very good, and there is a complete change in the way in which they behave. So this positivity which we can enforce following this kind of jaw improvement surgery is extremely rewarding, not only to the patient but also to us when we see that kind of change which happens not only in the physical form but the overall personality of the individual itself. That is very, very rewarding with this kind of orthognathic surgery or facial improvement surgeries.